Hey, y'all. This is Reverence for Impulse, and I'm Weena Pauly-Tarr. This podcast is my attempt to more deeply understand and explore impulse through conversations with people that inspire me. We step into connection without any planning or agenda, but with respect for the impulses that brought us here and shape how we are when we're together. I'm so glad you followed your impulse to listen in. Leslie Kaminoff was one of those teachers that came into my life at exactly the right time. He led a breath portion of my first yoga training and completely blew my mind. He had balloons and pressure chambers and a breathing measurement tool. And he spoke about breathing and demonstrated it in a way that I had just never heard before. It inspired me to shift towards a deeper and more tangible understanding of how bodies and specifically breathing actually work. I then took his 2-year advanced yoga anatomy course and kept following the work that came from his studio, The Breathing Project, in New York City. You might know him from the book he co-authored with Amy Matthews, Yoga Anatomy, which is used across the globe in yoga trainings. What I deeply appreciate and deeply relate to is Leslie's exuberant and bright-eyed excitement about how bodies function. I also really appreciate his commitment to staying authentic about his perspective and continue learning. And I can't leave out his unrelenting drive to make his own way through what can feel like a minefield of rights and wrongs in the yoga world. I really enjoyed our conversation so much. Here is Leslie Kaminoff. So it's interesting. You have such a good memory because that harness did a real number on me. And it was mostly, there was a lot of pain getting it off. That's what I remember mostly. Yeah.
Yeah, no, I remember having this discussion with you. It's like the human body did not evolve to have like that as your weight-bearing surface. And having very strange centers of gravity in suspension, hanging around, doing all of that movement, and your intercostals were going crazy, and it was just very unnatural. Strangely enough, I had another client who had a similar problem because she was in Aida on Broadway, and they had a lot of flying stuff with harnesses.
Okay.
And I was already familiar with her issues from having worked on
Worked
you.
on mine.
Yeah.
I remember something you did that I still reference that really was so crazy to me. It was so profound. And this is still an issue where my obliques want to turn on all the time. But I remember that you probably still do this, but there was some hip raise, exhale, lower, learning how to breathe all the way down.
Sure. Yes. You come down on the retention after the exhale.
Yeah.
Then you let the breath in. And because everything's been lifted so high by that previous movement, that inhale just drops everything all the way through the pelvic floor.
And there's a sensation of that I had never felt before. I mean, when you hear those cues, which I always resented the inaccuracy of, and it took me a while to appreciate that they're more imaginal cues. But when people say breathe all the way down or like into your pelvic floor, and I would get really hung up on the anatomy, that was the first time I really felt, oh, it's like you can feel what's happening because of this pressure, and
sure. Yeah.
the allowing that movement that happens by pushing organs down all the way through your body. That was really profound. And I've used it on a couple people and they've had similar
It can
wow
be
moments.
a life-altering moment when you actually feel that release.
And also the inhale come in a way that's not that feels the sensation I remember is that it felt like it was coming from the bottom, like it began low. That's how the inhale felt, rather than starting from the top and filling up. It felt like a pulling down. interrupting my conversation here just to make sure that you all knew about my next SEAM course that's coming up for SEPs, for therapists, somatic coaches, and facilitators. It's called From Patterns to Presence, and I'll be co-facilitating this 8-week virtual course with SE faculty member Mariana Bocuzzi. It starts May 1st, goes through June 19th. I've been prepping this one for a long time. I'm so happy to finally have it available. We have limited spots. You can find out more on my site, WeenaPauly.com, and find out more on Instagram at Pauly-Tarr.
Yeah, the more I work with the breath, and I've been, doing it for many decades now, the more I realize that there's really infinite possibilities of what you could experience in the shape changing in cavities that is breathing, and that's the sort of richness of the inquiry around breathing, is that there's no one right way to be doing it. But that's what I've been talking about lately when I teach, is there's that we have to hold that space for the infinite
Variation.
possibilities and whatever it is you're experiencing, and also hold that there are techniques that have a very specific nature that we train ourselves and people to do. And it's like you're either doing it or you're not. And that's the whole point, because you can see where you are in relation to this technique. Like, how adaptable is your system so that you can do this, and what's in the way if you can't. And that's the whole purpose of techniques. So yeah, there's a right way to do techniques, but there's no right way to breathe. And it's very easy to get stuck a little bit on either side of that equation, and miss that the dynamic of a learning experience is actually finding a balance between the technique and the inquiry. Because it's like the sthira and sukha of anything that's living. You need the boundaries and you need the space.
Freedom and form. This is the thing I talk about constantly. I feel like it's interesting that so I think that's one of the things that drew me to you as a teacher, and then wanted to continue learning from you, was that there were not straight answers about this is how you do it, which I really appreciated the nuance. I also remember a lot of answers when people would ask you questions were like, well, it depends. And I remember being like, yes, like it does depend. It completely depends on the body you're with. So any sort of dogma around this is the right way, I remember very early on kind of veering away from and not feeling super down with. And I think the first time I saw you, you lectured, my very first yoga training was Ishta. And did you come in and do like a breathing? I think you must have done like a breathing or diaphragm day.
Yes, in the early days of Ishta. Was it, which incarnation of Alan's studio was it though? Was it B yoga, or was it Yoga Zone, or
B? It might have been B.
It was B. Okay. Yeah. So it was after Yoga Zone, but before Yoga Works took over.
Yes, exactly. And I remember you coming in and being blown away. First of all, no one had explained breathing anatomically correctly ever. And this is someone, I've been a dancer my whole life, went to college for dance, and no one broke it down in a way that made sense. I remember you brought in balloons, and you brought in your thing that showed what, it was all these ways of explaining that I got so fired up about. I was so excited. I remember being thrilled, like jumping around. Really, it was like very life-changing. And then, kind of like desperately seeking Susan around, like, where is Leslie teaching?
Well, I didn't make it easy to find me after I showed up at another studio. That's terrible marketing. That's horrible.
I know. Well, none of us are that great at that, are we?
Well, we try to do a little better job of that these days. Yeah.
Yeah.
So I had totally forgotten that the initial connection was through Al Finger, and you were in the teacher training that they were running.
Yeah, I did that, and then I think I did 2 or maybe even 3 rounds with you.
Oh yeah, you could just come and go. You kind of stuck to the place a bit.
Oh yeah, I loved it. I couldn't get enough, and I wanted more Amy, and I wanted more of you, and it was kind of the only conversations I felt like people were having around why, as opposed to how. And I was really interested in that.
Yeah.
Yeah.
Yeah. And Amy deserves a lot of credit for um, helping to foster that environment there. Um, just so listeners know, we're talking about Amy Matthews, who is the co-author of our book, Yoga Anatomy, and an amazing educator, and knows a lot more actual anatomy than I do. Uh, so she's the one with all the letters after her name,
Mm.
who also came out of the dance world
And
herself.
BMC, right?
And well, she became and still is one of the top teachers of body mind centering in the world, and worked very closely with Bonnie Bainbridge Cohen, the originator of body mind centering. But as I was saying before you hit record, my history with BMC actually goes further back than Amy's, because in the late 80s, I was dating and later married a practitioner of body mind centering who later became head of the Practitioners Association, BMCA. And I remember when I first was exposed to that way of interacting with my own embodiment, having come out of just the yoga world at that point. I remember saying to Bonnie, like, every yoga teacher in the world needs to do this.
Mm.
And that was, the person who really deserves credit for introducing body mind centering to the yoga world is Donna Farhi, because she came out of a dance movement world, was a top Iyengar teacher, and wrote a bunch of articles for Yoga Journal and then books that were heavily influenced by body mind centering. But this was, years before that, and it deeply influenced the way I started thinking about my own practice and anatomy and breathing, and that was one of the sort of course corrections that eventually ended up with, well, the Breathing Project, which is where you landed. I was trying to think of what year that must have been that you first um, walked
Was
through
I
our.
still in Strab when
Oh
I
yeah, you
came?
were. Yeah, you were still dancing. That's true.
Oh, so early. And then I had to be like in 2000, maybe, or 2001.
Well, no, it couldn't have been. So wait, when maybe you weren't still with Streb. What year did you leave the company?
2003.
Because we opened the Breathing Project in 2003. So you must have been just post Streb.
Okay.
Yeah. Yeah. And before, in between Streb and De La Guarda.
Brian Brooks Moving Company. Actually, never did De La Guarda.
Wait, so what was the flying stuff wasn't De La Guarda,
Strab.
that was the harness stuff with Streb. Okay.
Yeah. That was
Right.
in the flying machine. It's like a fork that has weights on one side that are particular to your weight, body
Okay.
weight, and then
Uh-huh.
another fork on this side that the harness slides into and clicks into place. But
Right.
then there's the ring. So they're ball bearings where you can turn this way,
Hmm.
you can turn this way, and then the fork that it's put in can also turn, and the whole instrument turns.
So you're on a three-axis gimbal, basically.
One, two, three, four.
The,
Well, three axis. You're right. You're right.
well, I mean, there's three spatial dimensions, but yeah.
Three spatial dimensions, four ways of spinning.
Wow.
Yeah.
Yeah. Something humans really didn't evolve to do naturally.
Which is fine. I mean, it's interesting when you said weight bearing, because I don't think until you said that I ever considered hanging in a harness as making my pelvis weight bearing.
Hmm.
But that's of course what
But
that
in
is. But it's
dimensions that it wasn't designed to do, really, you know.
right. And it
Yeah.
was also the way, what was fun about it and what was interesting about performing that piece is people would always come up after and say, "Oh, that must be so fun." And I was like,
It's my job
maybe.
to make it look that way and not
Exactly.
exhibit the suffering that's involved. But that's true of so much dance, really, if you think about it.
Yeah.
You know,
People
I
have a
mean,
very
ballet, look
visceral
at classical
reaction.
ballet. Ballet,
Oh,
when it's done
yes.
well, is like weightless. It's
Oh,
beautiful.
ethereal.
And
Yeah.
yeah, and everyone knows there's a tremendous amount of suffering behind it, but you don't show it on stage.
I mean, what was interesting, I think, at the time was Streb wasn't into hiding the suffering. I think that was a little bit of a pre-program from my dance training to
Mm.
be a bit stoic about what it felt like.
She wanted the
Although
audience to know how dangerous it was.
Dangerous and risky for
Yeah,
sure. I don't know
yeah.
if you've seen their, have you seen their work recently?
Uh, no, has it mellowed or has it gotten no? Her eyes widen.
It is actually there's some pieces, well, I went to the 20th it was like an alumni concert.
Uh-huh.
20 years of being in that space in Williamsburg, which we moved into
Uh-huh.
initially.
Right.
And what was really beautiful is they did some old work, like Elizabeth Strebb's work from the 80s, which was so weird and amazing, like with a jump rope. Super simple and
Uh-huh.
really so much about fucking with form,
Mm,
like changing the way we relate to space and time and objects in a way that was so interesting and different.
mm.
And so they went through and did a couple different pieces, but the current stuff is I can almost not watch some of it. Yeah.
Well, it's interesting that you say that because look at what dance companies who perform live in front of an audience have to compete with. I can pick up my phone right now and see in the palm of my hand some of the most expert, extreme, exciting movers on the planet
Mm-hmm.
doing incredibly risky things,
Mm-hmm.
you know, and the novelty of going to see a dance troupe doing that on stage has to, in some way, at least match that, or well, let's just say it's competing with that, you know?
Yes, in terms of like risk and danger, but I do think what makes it different is the artfulness of it. So like
Yeah.
I'm, follow so many parkour threads and that was like a thing that I did and my son does. And so there's a
Mhm.
lot of interest in how people move through landscape public space. But yeah, you're looking at some of these insane jumps I'm sure you've seen online, like some of the craziest stuff you've seen in parkour. But
Yeah,
to me,
yeah.
what's more interesting is someone who's doing a really weird, dancey, fluid thing around a rail. I don't
Mm,
know. To me, it's like where is the how are you changing the way I look at a banister
mm.
rather than like how far can you jump between buildings? Like
But would you pay
I
money to sit in a theater and watch someone play with a banister on stage?
I would for sure.
Well, you would, of course.
Yeah.
Why should I doubt that you would say yes? But you see, I don't know if you know, but for many years, I was the company body worker at Pilabolus.
Yeah. I
Yeah.
think
Well,
I came and
you
had
came in and
body work.
observed, didn't you? You came in and watched at one point. Yeah.
I came and observed because you're working with Pilabolus at the Joyce, and I
Yeah.
came to do because I mean, when I say I sought you out, it was hardcore. Like I wanted to do what you were doing. And I
Mm,
think part of what was interesting was seeing you work with dancers. And that
mm,
was really thrilling to me. And what was interesting too was um, you had a deep knowledge of movement and dance, but you were coming at it from a very different perspective.
mm. Yeah. The yoga for me was the first thing, you know. I did
How did
19
you find it?
in
I mean, you've probably
1979.
said this a million.
Well, I found it because my dad was taking classes here in the city.
Oh,
He was having a midlife crisis. We don't need to go into all the elements that went into that, but well, part of what he was doing was yoga at the Shivananda Center on 24th Street. Um, and I was just recently moved out on my own, living on my own in the East Village. Um, and he invited me to a class, and I took a class at the Shivananda Center in 1978 when I was 20. Uh, what you may not know is I already at that point had determined that I needed to do something with my body. Uh,
how? What was that impulse?
because I saw how dancers moved just walking around on the street. There are a lot of dancers living in the East Village, and you could always spot them going to and from class and all of that. And then I was kind of comparing how they moved through the world with my klutzy movements in the world. And so the first movement thing I ever did was basic ballet at the Joffrey School, which was still on
Wow.
Sixth Avenue at that point,
Yeah.
um, in the West Village. And I took basic ballet classes. It turns out that one of the teachers lived 2 doors down from me on 7th Street because, I would spot her. And I so sucked at it. It was just, it was so clear that this was never something I would be really good at, you know. Um, and so I was reaching my sort of frustration level with knowing that, I would never excel at this thing, and feeling how klutzy I was. And it was right then that yoga showed up in my life.
Mm,
And the improvement that I felt from just the beginning to the end of my first class, the shift in how I was relating to, and there was stuff I couldn't do, there's stuff I could do, but the final relaxation is what really got me,
mm,
because that was just a different way of being
mm.
in my body,
Yeah.
you know. So that got me hooked, and that was 1978. Um, I maintained, though, a friendship and connection with the Joffrey School because I'd become friendly with the woman who ran it, Mrs. D'Addario. And so a few years later, they were, well, actually, it would have been just a year and a half later, they were casting for a show they were going to do on Broadway called Homage to Diaghilev, in which Rudolf Nureyev was dancing the famous Nijinsky roles that were originated in with the Ballet Russe.
Wow.
And so he danced Afternoon of a Faun,
Mm,
Spectre de la Rose, and the big finale was Petrushka.
mm.
Petrushka has a big crowd scene. You need a lot of supers, right? Supernumeraries. And they always needed boys. They had girls coming out their ears at the school,
Sure.
and they're always looking for boys in the dance world, whether it's as a dancer or a super or something. And so I was recruited to appear on stage, dressed as a Polish officer in the crowd, uh, in Petrushka on Broadway, on stage with Nureyev for like a
How
whole.
long did you do it?
There was a
For a month?
month-long run. It was a limited
Wow.
run, and it was in the spring of 1979. You can go on YouTube and see that production that they did
Mm.
for great performances later that year, at Lincoln Center. I wasn't in that one because when they were filming that, I was in Canada getting trained as a yoga teacher, but I would have been in that video if it weren't for the yoga.
It
Uh,
makes sense to me that that you have such an interest in dance now. I mean, it seems like it was right there next to you
oh yeah.
alongside your inquiry of yoga. And yeah.
And to be honest, I was just incredibly attracted to dancers.
Mm.
Always. I mean, who wouldn't be, really? Um, so there was that. I mean, in later years, I had to be very professional about it because they were coming into my office and taking their clothes off. But just that was some of my earliest, like, memories when I started my bodywork practice was, you know, because I worked with a lot of dancers early on because my apartment, my studio where I started my practice was on 7th Street between First and Second, which is just a stone's throw away from Tisch,
Oh,
the dance department, right, of Tisch, NYU. And so I started getting a lot of referrals of these kids who were just torturing their bodies in the Tisch program. Um, and you know how dancers are about taking their clothes off. They don't give a shit.
no.
And like they'd come in and I'd have my back turned for a minute, like getting things ready, and I'd turn around, there'd be a naked dancer saying, how do you want me on the table? So I had to develop a sense of professional decorum and boundaries very
Mm-hmm.
early on.
Mm-hmm. As a
And
young straight male in the yoga and dance world, I'm sure that's a different
yeah,
vibe. I mean,
yeah, yeah, absolutely. And but they were extraordinary bodies to work on. Some of the earliest clients I had came out of the dance and the athletic world because I started when I was still in LA in the 80s in sports medicine, and got to work with world-class athletes that were training for the Olympics.
what were you doing? You were giving them, was it like therapeutic yoga or?
Well, not at first. I was originally hired as a biomedical technician, strangely enough, working with this very new advanced bit of therapeutic equipment that delivered microcurrent to soft tissue injuries. It's kind of a long story how I learned how to use that equipment, and eventually was a rep for the company and was selling them to other practices. But that's what got me in the door of the International Sports Medicine Institute. And this would have been 1982 in Los Angeles. And that was what I was hired to do. But I was working with patients with this equipment in the main therapy area of this Sports Medicine Institute, which was actually started by a chiropractic orthopedist named Leroy Perry, very famous sports medicine doctor. And this was all in the lead up to Los Angeles 1984 Olympics. And so
Oh.
he was treating a lot of athletes, a lot of them from the sort of track and field world, along with other athletes and celebrities. He had a lot of celebrity clients, and the place where I was working was right next to the X-ray station. And he had this habit of taking full spine X-ray films of everyone's spine who walked in the door, front and side views of everyone's spine. And I got to watch them being marked up on the light box right next to where I was working. And I asked a lot of questions, and I wasn't a doctor. I wasn't a therapist. I wasn't licensed to do anything. I barely got out of high school. I'm a self-learner, like an autodidact is what they call it. And so the guy, the chiropractor who was marking up the films was very generous in answering my questions. And so I was like doing the opposite of teaching yoga at that time, because from what I saw on those x-rays, I didn't want to teach anyone anything because everyone's spine was fucked up. Because you see what spines look like in an anatomy book, which is artwork. These are the idealized sort of images of what the sort of normal bodies are supposed to look like and what normal spines are supposed to look like. And that's absolutely not what was showing up on that light box when it was marking up these x-ray films. And so one of my questions was, okay, so these are the fucked up spines. These are the people that are coming for help to a sports medicine clinic. So all the people with the normal spines are the ones walking around out there, right? And he was like, no, everyone's spine looks this way.
Yeah.
So, everyone's spine has this, some rotation, lateral deviation, structural abnormalities, or whatever it is that they were looking for. And it's like, and then I started trying to picture those spines doing the things I was asking people to do in the yoga classes I was teaching. And it freaked me the hell out. It made me want to stop teaching yoga altogether. And I did. And it was only after I learned a little bit more about the incredible resilience of the human spine that I had the confidence to start asking people to do things. But it changed the way I was teaching. Because in Shivamaya yoga, you're doing headstands and shoulder stands and plows and all these things. And, it made me rethink some of those postures for sure.
That's clear in how you teach. I think that was also what was so interesting to me was it was the first time somebody kind of honestly spoke out against this idealized anatomy books of all of it, organs, all of it. None of it looks that way. I mean, I've still on my bucket list is the Gil Headley workshop because I want to get in there, but it's not dissimilar from all the idealizations around bodies that are constantly kind of taught to us and forced to us and culturally imprinted on us. But that's definitely true in anatomy books. And it's the only way I think that's made sense when I started understanding through your class and teaching, like, this is basically a map. This is showing you like a hiking trail. This is like where the markers are. This is not what it looks like when you go hike that trail. It doesn't look like the map. That's also true in bodies. Like, it's basically a general, like, this is sort of here. This kind of goes there typically, but it, as you said, it's so different on each body. And how much we, when I find teaching with movement, teaching bodies, teaching training, which I still do, there's still these questions around what it should look like.
Yeah.
And there's so many, you're having to dispel these images of a proper spine all the time, or like, aren't I supposed to be like this? Aren't my shoulders supposed to be back? And it's so frustrating to
Yeah.
say this is a living, functional
Right. Shouldn't I be
body.
holding the spine in neutral all the time to keep it safe? You know, and I call that like pulling the yoga stick out of your ass.
Yeah.
Right.
It's not
Uh,
far from any technique, right? Like ballet. I mean, I think what drew me to yoga too was technical. I liked it doing really well in some of these, like getting it right felt so good. And it
well,
wasn't
that's the
until,
experience of many dancers when they first come to yoga is
right,
how easily the asana comes to them. And it's like, well, it's not about doing what's already easy for you,
exactly.
you know.
And I think you're the first person who explained why alignment. Whereas when you're force fed as a dancer through many decades,
Hmm.
you don't really question alignment. It's just the thing you're supposed to do well. But for
That's
what?
technique, but that's the nature of technique, and
But I
that's
think you were
right.
the first person who said you alignment is so you can move better, so you can breathe better. It's very simple, but those are the kind of things that we're not.
Yeah.
That's what I mean about the why alignment. And
So
I
in all
think
your dance training and movement training up to that point, nobody had really had that sort of organic functional perspective to
I'm
temper
sure,
the
I mean,
technique.
surely in college there were some teachers. I mean, what's interesting is you could not ask me to go to an improvisation class. Like I would not go to improv. I hated contact. All of that was like because it didn't have technique and form, and I really wanted to perform.
Hmm.
And it wasn't until now that it's taken me a long time to sort of understand the value in reclaiming movement and reclaiming even alignment and looking at alignment through cultural lenses, like alignment
Yeah,
for whose body, what culture. Like this is,
sure.
some of these questions around how I'm supposed to stand and sit are based in something very specific that is not applicable to everyone. And I think part of what I felt that discord in dance early on was, I mean, fundamentally some incorrect things. Like I said earlier, like cues. I don't know if you've ever heard someone talk about extension where they say lift from your inner leg.
Hmm.
And I remember being like, what the fuck? What does that mean? That's not lifting anything. But it was a cue. It was a cue to externally rotate and incorporate more of the back line of the leg. But really, let's talk about what's happening when you lift your leg, up from gravity and you're in a gravitational field. It's not, I
Hmm.
think, and some of that rubbed on me in a way that felt ungenerous but also incorrect. And I think it was through sports training and wanting to dive deeper into anatomy and functional anatomy and biomechanics and how things worked,
Hmm.
and to understand how and why, that I started to um, let go of it.
So was your original training classical when you started? So
Yeah,
yeah.
but I'm not a typical ballet body. Like I'm very strong and low, and so I think it
Yeah,
would
you were
felt.
jacked when I first met you.
Yeah.
You
Oh,
were,
yeah. Well,
yeah,
I think that's always how my body wants to be very strong.
yeah.
And so it was not good.
Mhm.
And so some of the times, like using the muscles I had to lift my leg wasn't good ballet. It was like a feeling of not belonging and I wasn't ever doing it right or well. The places I felt like I got it was in West African class when we
Really?
got low. And it
Oh,
was like, use your legs. I was like, yes, please.
huh. So that was your first sort of breaking out of the classical form was
Yeah.
African
And
dance. Yeah.
and hip hop and some of that started to feel like more of what my body felt comfortable doing.
Hmm. Interesting.
Yeah.
So when did you hit New York City?
So I graduated in 98 and moved September of 98.
Right. So was Andre Bernard still teaching then? Did you do any of the ideokinesis stuff? Any of the
No.
visualizing movement potential kind of,
No.
whole Mabel Todd, Irene Dowd, that whole
I mean,
lineage?
that was taught to us a little bit in college.
Yeah.
I remember feeling curious and kind of excited about some of those ideas. And
Hmm.
even BMC came in for a semester, I think. And I remember feeling like, ooh, this is definitely where I want to go.
Mm. Mm.
What's interesting to me is that for somebody like you who, let's say 1978, you started yoga, the
Yeah.
commitment to a form for so long, and granted, it's changed, I'm sure, for you. And I would love to hear how
Yeah.
it's changed. And even in
Majorly.
an aging body, like what is different, your relationship to yoga, or how does it look? I remember you talking about that in class also,
Mm.
really authentically, which was refreshing.
Yeah.
But
Yeah.
it's interesting,
Like,
anyone who's been so committed to a
mm.
singular form for so long, I'm fascinated by that.
Yeah. Well, I don't know what singular form
Yeah.
I would identify as.
Hmm.
You just mean yoga in general as
Yoga as a,
practice?
you know,
Yeah. Yeah.
umbrella term.
Yeah. But we see when I think of yoga, I don't think of just asana. See, that's the
Right.
thing,
Yeah, yeah.
and so it's a way of looking at life and the world and just reality in general. It's a lens for me, yoga. And that's why I
Right.
started to say earlier, starting in 78, 79, the lens through which I viewed everything else I was encountering, whether it was anatomy, the spines I was seeing on the box, or physical rehab, or biomechanics, or the body work that I learned to do with my hands. Everything was being filtered through that way of looking at the world and bodies, and my interests and experience were all this filter. And so it helped me tremendously to sort out which details were important, relevant, interesting to me, as opposed to the ones that are potential. All of it is potentially interesting from a certain perspective. I was never going to be a surgeon. I was never going to be a medical person of any kind. I don't function well in other people's structured learning environments. Um, uh, Being, the autodidact that I am. But I found yoga to be this very powerful lens that helped me um, focus on the things that were important. And what became clear right away, as soon as I started consistently having my hands on other people's bodies, was breathing. And how much the movements of breath, and where those movements were going and where they weren't going, was so core, literally, to what people's experiences of their bodies were, and in particular, what would bring them to someone like me for help with whatever pain or dysfunction or difficulties they were having, and bringing it all back to the breathing on some level is what I found to be the connection between the yoga and the body work and the anatomy and all of that. Um, and then, the other thing that I'm very, very fortunate about was, over the years, being connected with really smart people that I could collaborate with and learn from, Amy being chief among them, in the years of the breathing project. Um, and so, I always give her credit when I hear some version of her words coming out of my mouth when I'm teaching. And and also, you know, when I know that those words of hers are some version of what she heard, like Bonnie Bainbridge
Mm.
Cohen saying at some point. So, it's like I'm like a walking footnote section sometimes when I'm teaching, because I really do pay attention to giving credit where credit is due, because I know the thoughts I have that are original, and I know the ones that came from Jessica Char, and I know the ones that came from Amy, and the ones that came from Bonnie, or Gil Headley. You mentioned Gil Headley,
Mm.
where I did my first cadaver dissection experience. We teach cadaver dissection now as well. Um, uh,
Who's we? What do you mean?
well,
Oh, through yoga anatomy? Through,
no, well, we actually work in Gil's lab in Colorado Springs. And I teach with Lori Nemitz, another very smart lady that I've learned a lot from, who comes out of the dance movement world as well. She's a master dissector. She worked for many years with Tom Myers and has done a lot of labs. So she and I co-teach, and Lydia as well, who is very, very good with the scalpel and produces the events. So we
Hmm.
have something called KNM Labs, Kaminoff Nemitz Man Labs, and we've produced events since 2020, where we do
Wow.
take people in for a week of dissection and movement and breathing and all of that. So, maybe
Wow.
you can put that on your
Ooh,
bucket list.
yeah, definitely. Now that I
We'd
didn't know
love to
about
have
this,
you
this is
in labs.
exciting.
We
So
attract a lot
where
of
are
yoga
your,
people. Hmm?
what's up?
We attract a lot of yoga and movement people. We have a whole contingent of pole dancers, actually, who
Amazing.
come in. Did you ever meet Marlo Fiskin at the
No,
Breathing Project? She came
I
on
don't think so.
scholarship from Equinox, and she's like a world-class pole dance performer and teacher. And
Amazing.
turns out a
I
lot of
just
her friends.
saw there's a pole studio near my studio. And I was like, ooh, I kind of want to check it out. There was somebody I just saw do, it was almost like modern dance pole.
Uh-huh. Yeah,
It was
yeah.
not, which is interesting because I think you do need a lot of flesh in order to stick and have grip for certain
Oh, it's
postures
amazing.
and
Yeah,
positions. But
yeah.
she was like in sweatpants and a t-shirt. And it
On
was
the
almost
pole.
sort of, it was like a combination of dance meets parkour meets pole. It was like a
Wow.
interesting, and again, it was one of those things I got excited about because of how interesting and different her relationship to the pole was. Very unique. But
Yeah. Well, right around the corner from the Breathing Project is Body and Pole,
oh yes, heard of it.
which was started by Marlo and
Okay.
another friend, colleague, client of hers and mine, who basically just built their dream pole studio.
Amazing.
Yeah, and they do they I think they managed to keep it open, and that became one of the major places in the city for
Mm.
pole. So yeah, and as I said, I'm really lucky because when you look at the range of people I've been able to work with. On one end, you've got world class dancers, athletes, performers. We've taught at the International Contortion Convention. You know, right?
Why talk about spines?
Oh,
Mm.
yeah. And then on the other end, people with really severe disabilities,
Mm.
or who've had full lung transplant surgery, or like brainstem tumors, and just you know as wide a range of humans experiencing what it's like to be in their bodies as you can imagine, and everything in between. It's funny because every so often I get a client who's they're very concerned with, like, okay, so this is like the worst problem you've ever seen. I was like, no, not even close. And I
Mm.
tell them about that spectrum. It's like, okay, on one end of the bodies I get to work with are dead bodies in the lab. Okay, so cadaver on one end, Olympic athlete, world-class dancer on the other. Where are you on this spectrum, right? Well, you're way past middle on the side of the Olympic athlete, because I don't think you have any idea how
Mm.
how far it goes in the
Mm-hmm.
other direction. So don't put
Do you
yourself
find,
on
yeah,
that spectrum where
close.
you don't belong.
Do you feel or do you find that there's a demographic, for lack of a better word, but a kind of mobility or body that is a click for you that you find yourself working most easily with, or you feel your skills come
Hmm.
forward in a
Hmm.
different way, in a more direct way?
I don't know if it's a type of body per se, um, but that's a good question. It would be more someone who, for whatever reason, shows up at exactly the right time in their life, in their journey, for whom my particular skill set and perspective is exactly what they need to get to wherever they're going next in a profound way, you know. And so it doesn't look like a body type, it's more like a place in one's life where they're ready for like a major aha moment, you
Mm-hmm.
know, where this new experience of what it's like for breath to move through their body is going to have a whole lot of stuff that previously didn't seem connected all of a sudden come together and make sense, whether it's physical symptoms or chronic pain, or this leg that doesn't quite work the way they want it to be working, or whatever it is. And I've seen it happen again and again, where there's this shift that occurs. And I call them aha moments for lack of a better term, but the 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 the, the person that's ready for a major aha moment is the person that's already had any number of uh-oh moments. you know because if
Mm-hmm.
you think about it, the ahas are comprised of like pieces of your experience all of a sudden coalescing into a more unified, integrated whole, and you can
Mm-hmm.
see things from that perspective clearly, whereas before maybe you couldn't. But the pieces that come together to form that whole have to be pieces in the first place. And those are the uh-ohs. That's where the stuff you thought you knew has shattered into pieces, you know, like the things that you used to be able to do with your body you can't do anymore. Or I get a lot of people that also teach yoga, and a lot of times you start questioning the stuff that comes out of your mouth when you start learning new things. It's like, maybe I don't want to be saying that anymore, you know? And so there's this breaking down, because let's face it, someone doesn't come here and pay money to line my table, and literally make an investment in that experience unless something that was previously working isn't working so well anymore.
Mm-hmm.
And so, they're usually ripe for an aha because they've already got a few pieces lying around.
And there's some kind of divine timing and like where you are and what kind of like the answers that come to you or the way you start working that just clicks, I imagine, in a way that's not necessarily understandable or
Well, when you
repeatable.
work with breath, you're working with spirit,
Mm.
right? Just the word itself, spirare, respiration, it's all the same thing. And, I don't have any particular spiritual or certainly religious perspective or agenda that I'm pushing, other than it's the breath that's going to um, be the life force, literally, behind this exploration that we're embarking on. And that's really, really powerful, because so much of chronic pain is what's happening in the brain, in the mind, and the emotions, and not the stories we tell ourselves about the physical injuries or sources of that pain. I know that in the courses you took, I often would reference John Sarno, and his work, with back pain, um, and his perspective on how we handle our emotional life will often result in this chronic pain that doesn't respond to, conventional treatment. Um, More recently, and research supports this, it's been called neuroplastic pain, which is like most of chronic pain, and it has nothing to do with physical injury. It's basically the body taking what is normal proprioceptive information, which is benign, and interpreting it as pain.
Relationship. It's a relation, how you're relating to pain or
How
sensation.
you're relating to body sensations
Right.
that often get turned into pain. And so there's a whole way of reprocessing that. And, you know, um, that's just something that sort of naturally happens in the way I would either teach yoga or conduct a bodywork session, is to just be a neutral, like you were talking about authentic movement earlier, to be a neutral observer of your own experience or of someone else's experience, you know?
That's the only way to come in contact with understanding what your patterns of relationship are. Unless you are thwarting your pattern, you cannot meet it unless it's brought forward either through witnessing yourself or being witnessed by someone. Are you able to really come in contact with what the operating MO is here, the system that's
Absolutely.
in place? Yeah.
Yeah. Yeah. We just call it tapas in yoga, working against the grain. And that's what technique is for, really, to go back to the technique thing, the effort we put into learning a new technique, whether it's a movement technique, an asana, or a breathing pattern, is really it's learning a new way to breathe. Basically, confronts you with your old way of breathing and
On
how
a
stuck,
primal level, right?
yeah,
It's
yeah,
a
and how
very,
stuck
yeah,
you may be in it. Can
yeah.
you unstick yourself from this habit that you didn't even know you had until you tried something else?
Right.
Yeah,
Here, I have two questions coming up. I mean, so one is, have you worked with mechanical breathing, people who are
ventilated.
unventilated? Yeah.
Um, no, I've worked with people that had at one point in whatever their journey has been on a ventilator, but not with someone that is actually hooked up. It would be very interesting if I had that opportunity,
Yeah.
but I've not yet done that. Have you?
No, but I have been a witness to it. So that's
Oh,
interesting. And what
hmm.
about intubation?
Um, well, that often goes along with the mechanical
Right.
ventilation. Again, people that have been intubated for whatever reason, but not anyone that actually has the tube down their trachea.
Mm-hmm.
Yeah, yeah, yeah. Well, I have a client that years and years ago had a very extreme cancer surgery called a radical neck dissection, where there's a lot of musculature missing from the neck. He had neck cancer and had a lot of radiation treatment, and there's a lot of scar tissue. He doesn't have a sternocleidomastoid or an upper trap or a rhomboid or the platysma. Like a lot of that's
Mm-hmm.
been. They don't do that surgery anymore. Thankfully, they have other ways of treating this now. Um, and he eventually lost the swallowing function. So he has to be fed through a tube that's inserted directly into his digestive tract. So that's the closest I've come to that level of disruption of normal function. And he has breathing issues. So, yeah.
Yeah. I mean, I just think that the sort of, when we, like you said, the breath as spirit,
Hmm.
when it's being brought in or sort of operated by something external, I'm curious about that. I mean, it's a
Hmm.
shifted relationship. And so,
Yeah. I
yeah, the
mean,
pressure systems are being played
reverse.
with. Yeah.
It's reverse because when
Yeah.
you're being ventilated, the causal chain of breathing is opposite of what it usually is. Usually,
Right.
it's a shape change
Right.
that our
Decrease.
musculature induces in our thoracic cavity, which increases its volume, lowers its pressure. Air is pushed in by the atmosphere.
Right.
For someone that's ventilated, air is being mechanically pushed in by the atmosphere, which leads to a volume shape change of the thoracic cavity.
And so is
So
the
the
exhale
reversal.
just the release of that? Or there's nothing drawing air out?
When you're being ventilated,
Yeah.
or no, the pump shuts off and
It
the
just de
elastic recoil of the tissues are responsible for getting the air out. It's not being sucked out by the machine. But
But
this
then
is
do you never
complicated by,
reach an
hmm?
exhale? Well,
Like,
so because so you're in that's so interesting. I've never really thought about that. So your diaphragms being drawn down by pressure, not through muscular engagement, obviously, because it's
Mhm.
right, not working. But
Yeah,
then it just goes back to a resting state. It doesn't actually, there's no there's no full exhale. It just goes back to stasis where it's reaching the same pressure as the outside.
yeah, yeah, which is created by the recoil of the elasticity of the
Right.
lung tissue and the other rib cage structures, and the fact that there's always a pressure differential between the thoracic and abdominal cavities. The 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 organs within your chest cavity live in a lower pressure zone than your abdomen. So unless there's some breach like a pneumothorax or something. So there's all of that. So yeah, the machine isn't sucking the air out. That would be complicated by something like emphysema, where the elasticity of the lung tissue has been destroyed by the disease, and then you have a really nasty situation.
Right.
Yeah, but to dig into your point there, most people have never experienced a full, complete exhale in their bodies.
Hmm.
And what I say when I say full complete, I don't mean emptying air from the lungs completely. You can never do that. There's always residual volume. But one of the things I do on the table is I take people's structures, breathing structures, past the point that it usually goes on an exhale, and get them to experience what it's like to have the breath coming into them
Mm.
that place, as
Like a
opposed to,
vaginal birth, basically like squeezing through, right? The baby gets squoze through all the way, right? And that first inhale is of there's no, they're
they're
not
not born with air in their lungs. Yeah. And there's a certain amount
right.
of fluid that needs to
Like
get squeezed out. Yeah.
yeah.
Yeah. Yeah. So what was that like, Lena?
Me giving birth or
Yes.
having being birthed. I can't remember being birthed, but I
No,
do think there's
no,
something about like,
giving birth.
oh God, I don't know.
Did the amnesia set in around the actual?
Yeah, where you're like, oh sure, I could do it again.
Yeah, you
Yeah,
see,
no.
and if that amnesia didn't happen in humans, the race would die out because you'd
Oh, for
never
sure. Yeah.
want to
Yeah,
do
yeah, yeah.
it.
I mean, what's funny is you mentioned that I don't know that I had any, I don't remember my breathing. Like I didn't learn breathing techniques. I never learned any of that. Most of my whole MO in probably to my own detriment was I'm not reading anything. My body knows how to do this. I
Yeah.
don't want to take in anybody's
Hmm.
perspective or teachings. I'm just going to trust my body. I
Yeah.
could have used a little support.
Yeah. Or
Could have used a
override
little
what
learning.
is doing with a technique you've learned, right? Yeah. 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 So,
But it was, I remember doing a lot of sound. So I think that was about, it was like a lot of low sounds. And I
oh
think that
yeah.
was about breathing. But
Yeah.
yeah, I mean, I'm thinking of that first breath of a baby because it is so um, not like any other,
Oh,
obviously,
it's unlike any other breath you'll ever take.
you'll
It's the
ever
most
take.
powerful
Yeah.
breath you'll ever take because it boots up your whole respiratory and circulatory system.
Right.
It has to.
Right. And is
Um,
that pressure part like of in vaginal birth? Is that pressure and is part of, or is it already, I guess it's already under in, increased or decreased pressure, increased pressure because there's no air there. Right. So there's the
I
little,
mean, the pressure differential between the cavities, is
yeah.
that what you're thinking?
No,
Yeah,
between the
that's
baby and the atmosphere has not
yeah,
been challenged until they surface, right? I mean,
yeah, yeah.
so there's no like their diaphragm. Well,
Well, the diaphragm is active in utero because the baby will
right,
hiccup, the baby will swallow.
right,
There's movement. It's
fluid. Yeah.
ready to fire up
Okay.
and do its job. It's not breathing you because obviously there's no air in there, and the blood isn't actually passing through your lungs. The lungs are bypassed. And that's all the stuff that changes when you take your first breath. The hole in your heart seals up, and those uh, valves that divert the blood from the lungs, they seal off. The uh, circulation from the placenta, which mainly hits your liver first before it's distributed to your body when you're in utero. That sort of collapses and becomes the ligaments to support your liver. It's an unbelievable transformation that happens in those first minutes after taking your first breath. It's really amazing. Really, we're transforming from an aquatic to a
Right.
terrestrial creature.
Right.
You know,
In moments,
yeah.
not through decades and hundreds of years. It's like, it's so
No, it
crazy.
happens. Yeah, and that in that sense, we're recapitulating, you know, the phylogeny recapitulates, ontogeny, you know, that whole thing about how we go through different stages of evolution in our
Life.
intrauterine development. And
Yeah.
so it's not literally true, but there's certain aspects of it that
Yeah.
actually do um, sort of retrace those evolutionary stuff. We talk about this in the book in Yoga Anatomy,
Mm-hmm.
in the spine chapter. So
What about aquatic mammals? So they, like a whale
uh,
gets born, their mom pushes them up,
yeah,
but their pressure differential underwater is so different.
it is. But the thing about them is that it appears that the cetaceans that you're talking about, you know, dolphins, whales, air-breathing mammals live in the water. Um, Evolutionarily speaking, it appears they used to be on the land and they just decided to go back in the water. When you look in the pectoral fin of a whale or a dolphin, there's like hand bones there. Why? Why do they have like bony fingers inside a pectoral fin? You know? So but they breathe very differently than we
I
do.
was gonna say, because their their pressure system, like how is their diaphragm? I guess it's the same operationally, but then if you're, it's just heavier. Water's heavier, so I
Right.
guess
Well, they're dealing with enormous pressures
right,
when they're at depth, right? But they have to surface to breathe.
right.
So the
But that's
main
already changing density and pressure as they rise. So is there
Mhm.
something that's already starting to happen
I'm not
diaphragmatically
an
when they?
expert on the pressure mechanics of
What do you mean
cetacean.
you're not an expert on whale breathing,
Well,
Leslie?
the one thing I know about whale breathing is this, is that it's entirely voluntary. They
It's
don't
what?
have an autonomic mechanism.
Oh,
Think about that.
wow. It's always conscious. Well, that's
It
going to
has to be.
change.
Yeah, because if they slept like we did, if both hemispheres of their brain went to sleep at the
Right.
same time while they were underwater and they had an autonomic mechanism that made them breathe, they'd drown because water would come in their blowhole. So they have to surface, get the blowhole in the atmosphere, take a breath, go back under. So
And they
that's why
just,
we sleep one hemisphere at a time
oh God, because there, something has to keep track of
of
their
the
CO2
air. Yeah, yeah.
level.
That blew my mind the first time I
God,
learned.
that's,
I
yeah.
learned that on a whale watch boat out of Provincetown, where a marine biologist was taking us out to look at the whales and
Hmm.
was explaining certain things about whales. And this thing about their breathing just absolutely blew my mind because wrapping my head around what it must be like to be a creature for whom every breath had to be
A
sort of
choice.
consciously, intentionally taken.
Wow.
It's a
Yeah,
whole other way of existing.
completely.
I mean, have you ever seen a pod of dolphins
Mm.
that were just sort of skimming just below the surface? They swim down and then they come up and they go and they go back down again.
Yeah,
Then they're sleeping.
yeah,
That's
yeah.
how they sleep. Yeah.
We were
So
just at the aquarium in Coney Island. I took a hooky day with my son,
ah,
which I had been promised to do. It's been years that I said, we're going to do this. So finally, I took the day off and we did it. And there's a bunch of new, have you been to the new one? Well,
no, I have
new.
not.
I haven't been there in 10 years. It's a little awkward, but whatever. There's a part where you get to see the seals diving, you get to go under.
Mm,
And it is so fun to watch them breathe, actually,
mm,
and watch them. And actually, one, we're sort of laughing, but it's dark. There was a seal upside down up against the wall for a long time
Yeah.
in a way that we were like,
Starting to worry about the seal.
a little bit. And we started Googling, like, how long, basically what you're saying, how long can they be without breath? But knowing this was a choice, we did tell somebody, we were like, maybe check on that. That really changes things because then,
Yeah. Was it
yeah,
10, 12 minutes or something they can stay underwater?
I mean, I think it can go up past like 25,
Wow. Wow.
closer to, yeah,
Amazing. Hmm.
yeah.
Well, some humans actually can get close to those numbers in
Okay.
competition.
We're going to go personal inquiry now.
All
Okay.
right. Yeah.
So my husband has apnea, right? But
Okay.
both obstructive and central
So
nervous
he
system.
has night terrors.
No, my son does. That's another question. No,
Oh.
this is like, and we are convinced that he basically trained himself into it. And the
Huh.
reason I think this, he would be a really interesting case for you. I'm going to
Yeah,
send him
come
in
on in, bring him in. We'll have fun.
because he would do it he loved holding his breath underwater and would
Hmm.
do this weird thing, which freaked me out, legs on the side of the pool and then lean back at our
Yeah.
friend's pool in the summer
Yeah.
and just count. And he could stay, I think he definitely 2 minutes, but
Hmm.
maybe longer, maybe closer. I can't remember if it was, but I feel that you're kind of training your body to tolerate a certain level of CO2. You're basically
Yeah.
like,
Yeah.
right? You're training your system to tolerate higher and higher levels. And then my question is like, does that start to pattern your brain in a way that it
Maybe.
just
Well, that the central aspect of it, perhaps, but if it's obstructive,
well,
then
obstructive, no. I mean the central part.
yeah, maybe. I mean, he may just have an extreme tolerance for CO2, because that's what that training is about. And a lot of the methods for treating things like asthma work with that mechanism, like the Buteyko method, where you're training someone to gradually extend what they call the control pause, where you're waiting at the end of the exhale as long as you can comfortably without disrupting the next breath too badly, um, the next inhale. So you're basically lowering the threshold of your CO2 reactivity
Right.
in the bloodstream.
Right.
Um, and this came in handy for me, by the way, in the wake of my COVID recovery,
Oh,
where, I had the original Wuhan formula in 2020.
nice.
Yeah, well, not so nice, but anyway,
The
you know,
original. The
yeah,
OG COVID
yeah, I had the OG, I had the OG
version.
COVID. Um, and I caught it in Sydney, Australia, the same time Tom Hanks did, basically. Uh,
Fancy.
yeah, that's what let the world know that anyone could get this, anywhere, was when it was reported that Tom Hanks and his family had come down with COVID. Um, and so, that messed with my CO2 threshold. It messed with so many things in my
In what
body.
way?
Well, if
Made
my
you less
normal range,
tolerant or
well, if my normal range of breathing was, like I'm putting my arms out to the side because we're just on audio here, like, you know, as wide as my arms are, and one end is deep, full breathing, and the other is quiet, relaxed, shallow breathing, all of which is normal depending on what I'm doing. Right. Now I'm bringing my hands about a foot apart as opposed to 6 feet apart. That's where my range was, because if I went too far in the direction of deep breathing in COVID and post COVID, I would start coughing uncontrollably. If I let my breath get too shallow, I would immediately feel um, suffocating panic of not having enough air. So my normal range was reduced tremendously. And if I didn't have the ability to connect with and recalibrate my breathing as a result of all the years of yoga and all of that, I could easily see how people were getting into extreme distress really, really quickly with this
Right.
virus and having some kind of hyperventilative crisis, and needing to be transported to the hospital. They end up intubated, and so many of them didn't survive that, because now we know they were killing people with intubation, you know. And so my my ability to be in touch with my breathing and interrupt my normal breathing cycle so that I wouldn't be pushed into a coughing or a suffocating crisis, was something I was able to do, but I had to maintain. I was like a whale.
I was going to say
I
conscious
had
breathing.
to,
Yeah.
I
You
had
had
to
to,
really be conscious of every breath I took for an extended period of time, when I was, in the midst of this COVID crisis, and then recovering. I had to recalibrate, and a lot of that involved working with my CO2 tolerance,
hmm.
and I had some help from a wonderful friend and colleague, Robin Rothenberg. At that point, she wrote a wonderful book called Restoring Prana. She's a yoga teacher, yoga therapist in the same tradition of Desikachar that I am, and she runs a training program and all that. And we had connected, and she heard about my COVID thing, and she volunteered to do, like an online Zoom thing with some of the techniques she was working with. And it wasn't anything I wasn't familiar with, but just having someone else guide me through it,
Oh,
uh,
yeah.
from her perspective,
Sure.
like it's like authentic movement, but on a breathing level
Yeah.
kind of thing, was really, really helpful at that particular time when I was still in the sort of long COVID recovery thing, which I mean, I'll never not be in long COVID recovery from, like,
Really? Yeah.
in a certain level.
Oof.
Yeah, it just,
I mean, I still haven't
it
had it
fucked
as
with
far as I
me.
know. I'm sure I have and maybe didn't know it, but
Well,
it's
you're
sort of,
lucky.
I know. No, I don't know how my son and I have not ever tested positive. So,
Yeah, I've had it 3 times actually.
oh, God. Um, so my deep inquiry the last, I would say 4 years in particular has been around impulse.
Mm,
And so
yeah.
what does that mean? What do I mean when I say it? And one of the ways I try to guide people through bodily impulse first
Mm,
is what you just described, is
mm,
learning to feel, and this is um sh- probably 100% from you, but going to the end of the exhale
oh, mm,
and then waiting. And what I say is wait for your body's request to breathe and then
mhm,
respond.
yeah, right.
And I say it obliquely because what I'm trying to get, or what I'm offering people, is an invitation into understanding what their relationship to impulse is.
Yeah,
And the impulse, which you're describing, which is sometimes there's intention to feel the request for breath and wait
yeah.
because there's an intention of increasing tolerance for CO2 or discomfort, or in general, identifying a pattern
Mm,
that is like a quick response. Wait, let me play with this. Let me see what, and so it's one way of identifying a relationship to impulse, which to
mhm.
me at the breath level, of course, is core and sort of ripples out patterns
Oh,
beyond
it
that.
doesn't get more primal than that. Yeah.
Yeah.
The impulse to stay alive
Exactly. And
that
that's
your
why I think
body
it's
has
so,
independently of your intention.
yes,
Yes.
yes, exactly. And I think that's what I'm, when I talk about aliveness. And I mean, the reason why I think I've been so excited and giddy about impulse in general is everything you're talking about, it fits right inside there. And it's making me realize like how fundamental my learning with you around breath and breathing was to
Mm,
this inquiry, because it is, in somatic experiencing, we're looking at nervous system patterns
mhm,
and authentic movement. And it's different. I think the way I use it is very different from the ways you might see it out in the world, some more like dance therapy world, or um, choreographically and in dancer world.
mm,
But to me, it's that question of what wants to happen
mm,
in this moment. And that can be through movement, but I'm thinking now about it in terms of breath. What wants to happen? And here's what, Nick Beam, my friend, would say is there's the impulse to breathe and there's also the impulse to wait and increase tolerance. So like those are both impulses actually.
and in the other
But
direction, there could be impulse to breathe before your body actually needs it because
right.
of some
Pan
panic
whatever, like,
or,
yeah,
trauma or
fear of
whatever. Yeah.
scarcity, or yes, fear.
Yeah.
It's a trauma pattern of like not wanting to be without.
Hmm.
Um, and it is so interesting when I bring that question, like what wants to happen, because what wants to happen is what you're describing is, I feel like I need to breathe. And what also wants to happen is a desire to push against that and grow
Hmm.
and increase tolerance. And what wants to happen, and those are, so the question starts to become a deeper winding road, and probably harder to answer. But to me, when it lines up with survival, which is sort of at the crux of somatic experiencing inquiry, but also I think what inspires me around authentic movement is when it lines up with survival or aliveness, it seems like it's answering itself. So
Mm. It's a deep, deep inquiry that there's no end to it. It's like the ultimate koan, if you will, of life, of breath. And
mhm.
that's often where I'll leave people in shavasana after whatever other process I've talked them through, assuming they're still conscious and hearing me. It's, I lose some people at the ankles, but because they just are tired and need rest. But
Yeah,
for
that's what
those,
wants to happen, is
yeah,
sleep.
exactly, and that's fine. There's no
Yeah,
judgment there. Sometimes I do ask permission to nudge them if they start snoring, but
I've done it.
when you get to the end of that process and you're left with your breath, it's like, can you observe your breath and not control your breath? Can you be the observer of your breath? Can you be the space? Can you be the space in which breath arises?
And do you think you can?
There's moments where that happens, but it's very, very tricky because because you have an intention to be the space. So the minute that space shows up, the mind comes in and says, "Oh, I did it," and then you're not doing it. So it's intentionally giving people almost an unsolvable koan
Yeah,
to ask
exactly.
that question.
Yeah.
And there are answers to that question that we come up with along the way, but there's no resolution to a question like that ultimately.
No.
Um,
And it's
and
moment dependent. I think that's
yeah,
probably what's exciting to me about it in terms of movement and impulse. Like, well, because of coming from a background of so much training of
mm,
body,
mm,
to ask, and I don't like framing this question this way, but to ask my body, what do you want to do? Which I don't
mm,
like that bifurcation, but it works sometimes.
sure.
Um, what I start, or what I have started to discover through, a decade now of almost weekly authentic movement, is when I'm able to allow kind of what you're saying, which is be in relationship to the breath that's happening, but not control it, similar to
Mm,
movement, like let my body move how it wants to move. I
mm,
find through time that what wants to happen is rebalance, integration, mobility, strength, like all the things I
mm,
think I need to work on and do,
right,
my body does
right.
when I give time and space for that to sort of spontaneously surface. And little things, originally, what sort of draw me to somatic experiencing and authentic movement used together was, in a somatic experiencing, you're identifying nervous system patterning, right? And
Mm,
sort of trying to understand maybe where that got caught up, and then how do you complete a survival cycle so that that pattern is not such a locked in default, right? So there's choice around it.
mm,
You bring back vitality to the system that has been holding and repeating this pattern in a way that's been limiting. But I think that's what our bodies, I mean, our bodies are doing that with movement all the time. And
mm,
so when there's the space to get out of the way and let my body move however it wants, it's not predictable. That's one thing I find. I can enter it with the same sort of intention or pattern. Oh, I want to and I often do. I'm often led by sensation. I want to feel this, or I'm going to move back here and this one. But then as time goes on and I lose tracking and I am not necessarily even aware, I'm aware, but like mildly, my body is doing what it needs to do. And the feeling after is more integration than I've ever felt in any other movement modality I've ever been a part of. It's almost like the feeling is that I got all these little quiet what wants to happens happened, and there's a sort of balance is not a good word for it, but integration is that I feel more whole in myself and more in my body fully. And I mean layers, not just tissue, but mentally, emotionally, spiritually, like in a way that I don't know that I've ever felt before.
Well, that's an incredible place for someone like you to be able to get to in their life and in their body and in their practice. And I say that knowing, having worked with hundreds of dancers over the years, because there's so many voices to get out of your head.
I know. Yeah.
When
Oh yeah.
your body is moving.
And
And
even just performer voices, like just the act
yeah.
of being witnessed turns on so much patterning about how to be in your body. You don't even
Mhm.
know what your body wants to do because you're, being held or sort of managed in this way because you're being seen. And so even just that first layer of having somebody see you in your body without direction or agenda is terrifying. It surfaces all the protection impulses of needing to look a certain way or manage what they see or be appealing or have value, or all that stuff turns on immediately.
Yeah.
And so you have to, in that way, and I think that's what's so exciting, I had to reckon with all those patterns in a way that I never had really come in contact with.
Well, there's the performative aspect that
Right.
dancers have, which is really hard to get past
Yes.
when there's a part of you that's your own best audience. And you have that aspect of your psyche that, and this happens to yoga teachers too. I talk about this it's one of the more difficult conversations to have with other yoga teachers. It's like, at what point did your practice stop being about you and being about the next class you were going to teach?
Yeah.
Like
It's
having a really,
it's performing. Teaching is a kind of performance. You're in, just look at it
absolutely,
theatrically, like the setup. You have one person in front and all these people facing you. I
right,
mean,
right. And you can have these cool moments of breakthrough. And then I'm talking for myself now. I can be on my mat and have a cool moment of breakthrough or insight or whatever. And the immediate thought after that is like, how am I going to share this? How am I going to teach it? I'm not saying that's a bad impulse
no.
because we're educators, but there's also an aspect of that will use that to pull you out of yourself,
Experience.
your experience.
100%. Yeah.
And it can be an avoidance.
Yes,
Yeah.
absolutely. And it can be about, the discomfort, building up COT. It can be the discomfort of building up resourcing, or just like you said, the fullness of and richness of an experience, and just having it for yourself.
Mm.
There's a lot of patterning for me around that being indulgent or not generous
Selfish.
or selfish.
Yeah.
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 And so
Our
it's
culture has put a stink on the word selfish,
mhm.
you know? So,
And performative isn't bad. I think also, like, what's been interesting to play with in my practice is, like, I feel an impulse to perform. I'm really aware of someone's eyes,
mm,
their gaze, and the
yeah.
impulse to perform is there. So do it. Like, whatever. What is that? you know? And really going for exploring, like, okay, I'm going to
Mm,
perform. I'm not just going to try. So much of it in the beginning was taking away that impulse and, like, what's beneath that? Or can I just stand here and be seen doing nothing or
mm,
being like silly and foolish? Or can I, like, and the hardest part is being seen not knowing what you're doing or why. And that's really deeply, deeply vulnerable. And I think for teachers especially, there's something pretty rich about being able to tolerate
Mm,
gaze and not knowing, deeply not knowing what you're doing, not knowing what's coming next, not knowing if it's good or
mm,
valuable or smart, and being able to actually have some sense of yourself as valued
mm.
or having value in that moment. I feel like that is a really a core experience that can allow a teacher to shed some of the efforting around, being a smart, good, impactful teacher, which are
Yeah.
not bad.
Oh,
Those are not bad things to want.
no, no, it's not a bad thing to need oxygen. I mean, but
Right.
that's the thing. It's like all of those dynamics, the psychodynamics and everything that you're talking about, um, show up in its most basic raw form in that moment after the exhale when we're waiting for the next breath. um, and our relationship to that. The way I talk about it, and I'm not sure if I was phrasing it quite this way back when you were at the Breathing Project, because I'm constantly trying to refine my language. Um, is that it's you have no choice about what's going to happen next when you pause at the end of the exhale. Your body is going to literally force you to breathe at some point. Okay. No one's killed themselves yet doing that I'm aware of, at least in my class, right? So something is going to happen. Some force is going to arise that will make you take that breath. You have no choice about that. But what you do have a choice about is what relationship do you have to this thing that you have no
Yes.
choice about,
Yeah. Yeah.
right? And I think that's such a fundamental life lesson about
Mm. Hmm.
how our characters get formed. We make choices in the face of the things we didn't choose. It cuts right to the heart of the whole nature and nurture versus free will discussion, because nature and
Hmm.
nurture, what they have in common is that we didn't choose either of them. It's what we come in with.
Hmm.
It's our genetic inheritance and how people treat us when we're young. We didn't have no choice about that, but we do respond to these things, and that's the core of what makes us who we are. And there's always choice on some level, even if we don't know we have it or are making the choices. It's there. And I think that's a pathway out of victimhood for a lot of people to recognize that. And at the most basic physiological level of our own life force, we get to experience that any moment we want to at the end of an exhale if we just wait and
Yeah.
see what how and you used the word respond. And I'm sure you did that quite intentionally when you were talking about this process, because that's different than react, right?
Hmm.
It's different than instinct
Follow.
or whatever.
Yeah.
Yeah. And one thing that really impressed me when I listened to you on Jay's podcast, um, I love it when like the Breathing Project alums get
Yeah.
together on
Yeah.
Jay was one of the original teachers at the Breathing Project. Um, but what impressed me was the your use of language and the way you choose to articulate your ideas was very, very clearly well thought out. You learn
Thank
to be
you.
as articulate conceptually and with your language as you learn to be with your body as a dancer. And that to me
Mm.
was very noticeable and very impressive.
Ugh, Leslie, that's so, so nice to hear. Really. That means so much to me. It's something I struggle with is language and words and finding
Mm.
ones that feel accurate and effective. And so, yeah, thank you for saying that. That's really nice.
Well, thank you for being that.
And for listening to that podcast.
Oh,
Yeah.
of course. It was a great way to spend some time hearing about amazing work that you've come to do, knowing a little bit about your background, learning things that I didn't know about, stuff you've been doing since I was trying to think the last time that we communicated prior to this. I think you were just starting your like Phoenix Rising practice.
Maybe, yeah.
So that was a while ago.
Yeah. And
Yeah.
it's funny, I felt sort of called back to some pieces of that work, and um it is really great work. I think in a way, I think I sort of regret being dismissive of it um after I had started doing it for a while.
Hmm.
Because there are things that I come back to that I realize are really effective, and people ask for over and over again. They
Hmm.
find very helpful,
Hmm.
a first centering meditation or an integration at the end of a session. I mean, these are sort of concepts you find in lots of different practices and modalities, but because I had been practiced in how to do it and the language of it, I think I'm probably more agile in leading that than other
Is that
ways.
what stuck with you, the language of it, or do you still actually get physical with people and support them in like, yoga type positions and engage in the dialogue?
It's funny, recently I did do hands-on, which I hadn't done in a long time, felt very edgy. Um,
Yeah.
but I don't do the movement of the going into a posture, or I don't
Mm.
do any of that. Actually, I feel um so strongly about helping and inviting people to move through their movements that I don't
Yeah.
want to do that. But I talk about it a lot. I mean, the way I describe edge is often from that training, where it's an edge of a stretch might not be where your edge is. Like if you're a dancer, a really strong edge is not an edge. It's familiar. An edge for you is not being anywhere close to an edge in
Yeah.
your
Well, for
physical
someone that's
body.
just hypermobile, an edge is
Exactly.
feels like pulling back from your end range, right?
And
So
that can spin someone out because they can't locate themselves inside a
yeah,
B minus, you know.
yeah, right. Well, you see that if there's one area that I think has changed most radically in the way I approach what I do on other people's bodies over the years, I think it centers around that discussion, which would make you reluctant to grab someone and support them in Cobra and have a dialogue. Um, it's bodily autonomy,
Yeah.
um, and not and becoming aware of all the ways that a teacher can, in subtle ways and with all the best intentions, sort of violate people's uh, bodily autonomy and agency, and how to hand that agency back as much as you can in the language you use, the cues that you give, the ways that you touch, if you decide to use touch. It's there's a lot more nuance and understanding of that discussion than there was certainly when I started teaching yoga
Yeah.
and like, yanking people up straight in shoulder stand,
Right.
uh, or
So you're not
pushing
doing that anymore.
feet down in plow. Yeah, no, I mean, that's the sort of stuff I wanted to stop doing the minute I started seeing spinal x-rays in the
Yeah.
80s.
Yeah.
The
Never
discussion.
mind what traumatic patterning you've like
Yeah,
reignited.
exactly,
Right.
exactly. And you remember in 2012 when that article came out in the Times, how yoga can wreck your body, right? The
Maybe. I don't know if I
William
do.
J. Broad article in the Times that was
Okay.
promoting his book Science of Yoga. And everyone, it was like it inflamed the entire yoga world, because here you had a decorated science writer for the New York Times claiming that yoga teachers were killing and paralyzing people,
Oh,
you
right.
know,
Oh,
and
now I
claiming that he
remember.
had evidence for it, you
Right.
know. And I'd say within months of that discussion inflaming the yoga world, so many places stopped teaching shoulder stand and plow and headstand and things like that.
Mm.
And like studio owners actually banning it from the premises,
Yeah.
you know. Um, and that's exactly the feeling I had in 1984, 83, really. well, actually, maybe it could, yeah, 83, when I started looking at these x-rays. It's like, holy shit, you know, I got to really think about what I'm asking people's bodies to do.
Well,
And
and an X-ray is bone. So you have no real, right? You're not seeing the relationship between bone and tissue and all
you
this,
see,
everything else
yeah,
that's happening. It's a static moment. It's just like photographs now.
sure.
How
This is,
accurate are they
yeah,
in depicting a three-dimensional living thing?
exactly. It's flat two-dimensional image of a three-dimensional object. And with a film that long, by the way, the only accurate part of the image is where the central ray hits, because it spreads and scatters
Oh,
towards
right.
the edges of the film, right? So I would, I was learning all of that, and I was being told all of that. And you're not really seeing soft tissue, although you can imply it because of the way spaces are maintained or not. So, yeah, there's all of that, but it was just it was really the shock of the actual versus the idealized, for me.
Yeah.
And that's, I was already involved in an inquiry about what was going on inside people's bodies when they're trying to execute the cues that I'm giving as a yoga teacher. So I had already deviated from the classical class structure and form at that point, which is one of the reasons I was no longer part of the Shivananda organization, among others. But just the desire to experiment
Mm-hmm.
and see what works for this person, you know, and having the breath be part of that inquiry from almost the beginning, is what made me so receptive to what I learned when I first encountered my teacher, Desikachar, in 1988. I'd already been teaching yoga for 9 years, but had been on this inquiry, for a while by the time I met him. So,
What's lighting you up with curiosity now? Like, what are you feeling
hmm.
excited about or most excited about?
um, well, there's a couple ways to answer that. Uh, I'm excited right now about getting back out into the world after this, 4-year long shutdown of everything and the disappearance of half the yoga studios of the world. Um, you know, Trying to see where there are spaces, out there to start traveling more and teaching. At one point, I was away for, like almost every other weekend, I was out doing something,
Mm-hmm.
some place in the world. And that hasn't been happening quite so much. But there are, opportunities and spaces, whether it's at a studio or a festival or a conference. There's a few of those on my calendar in this year that's coming up, 2024, more than last year and certainly more than the couple of years before. So I'm just excited about that. Um, and as far as my practice and working with other people, um, it really is, and it's almost a cliche that you hear from people that have been doing this for a long time, but it's really true. Accomplishing more and by doing less. Like,
Mm,
there's less interventionalist thinking and
yeah.
fixing,
Yeah.
intention in what I do with people, and much more, um, working with language and with people's own experience, and just making a space in which the change can happen. It's not like I'm not touching people anymore. That's a big part of what I do, but it's the
Yeah.
way I use the touch and the intention behind it. I have a very strong kind of fix it, mentality, and I have a lot of skills around that.
Yeah.
Like, yeah, let me put this bone back where it belongs, or open up this fascial plane that's stuck. And there's still some of that happens, but having it serve, um, there's a difference between healing and fixing.
Mm,
That's really profound. And, I'm just learning more and more about how to be in that play. It's like that moment after the exhale, Like there's something that's going to happen naturally here if I let it, or I can jump in and do something. Um, and so and that's good because as I get older, I'm about to turn 66, you know. Uh,
What?
I want to be less of a manual laborer in the world
Yeah. What do you
because
want? Do you imagine yourself continuing to just teach, and or do you see, like, is retirement a thing you want? Is it, what does it
hey, if
look
I could
like?
make enough money to retire on a horse farm and just, you know, be with horses all the time, I
Yeah.
probably would. I'd probably never stop doing what I'm doing, you know.
Yeah.
So um yeah, I don't think of retiring so much as you know, putting enough stuff online and developing enough maybe passive income from that so
Yeah.
I don't have to do the hourly wage stuff quite as much. Because there's a limit to how much of that you can do and how much you can charge for it, you know,
Oh,
and
I
that
know.
won't pay
Yeah.
for horses.
So do you have a horse?
Not anymore. We gave them
Okay.
all up when we moved out of the Berkshires. That was exactly 10 years ago.
Okay.
That uh, that we that I closed up the whole Berkshire horse farm thing,
Mm-hmm.
and we either sold or gave away the. At one point, we had like 5 horses. So yeah,
Mm.
yeah,
Wow.
yeah, and I miss them. I do. I kept my
Yeah.
saddle, kept my boots. You know,
Do you get to ride occasionally?
not nearly as much as I would like to.
Yeah.
Yeah, yeah. The last time I was on a horse was actually in Colorado Springs when we were there for one of the labs, and one of the best stables anywhere in the country is run by the Air Force Academy at their equestrian center, which is
Huh.
in Colorado Springs. And I was very fortunate to know someone that had a pass to get on the premises because you need a
Oh.
DOD ID to get through the gate. And we went, did a nice trail ride, but that was a while ago. So I'm
Mm-hmm.
ready for my next equine encounter. I'm going to try and figure out how to make that happen this year a little bit more. One of my New Year's resolutions.
Yeah. I think it's power. I mean, relationship to animals. And I had, when I was little, we lived in the country. I grew
Mm,
up in North Georgia, and we had 2 horses and
mm.
pasture. And I just, it's very, it has a deep mark on me, the smells and like dropping hay from the rafters to the, just there's a whole,
A good horse, a good relationship with a horse is like having an authentic movement coach
yeah.
because they amplify everything that's going on with you in real time if you know
There's
how
a
to
lot
pay
of
attention
somatic
to it.
experiencing and horse work.
I don't doubt it. They're
Yeah.
they're amazing creatures because they will form an opinion about where you're at in about 2 seconds and let
Mm.
you know about it.
And then it's a question of response. How do I respond?
Yeah, it is. Yeah, yeah. So yeah, equine somatic experiencing. That's got to be a great thing.
I don't know much about it, but I do know people, some people, colleagues and friends have really gotten into it. They love it.
Hmm.
It makes a lot of sense, especially with that lens of nervous system work.
Absolutely. Yeah.
Mm-hmm.
It's funny that we're having this conversation now because just on the way in from the Cape, I listen to audiobooks while I'm on long drives. And I was listening to The Way Out, which is Alan Gordon's
Hmm.
book. And he's the guy that talks about neuroplastic pain.
What's his
Sort of
name?
uh, 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 Alan Gordon. He's based in California, I believe. And it's an approach to healing chronic pain with the understanding that it's most of it is being generated by the brain. It kind of takes the Sarno discussion into a whole another dimension. And they did large scale studies using fMRI to see the changes in people's brains when they're experiencing pain
Hmm.
between before and after the process that he's developed, which is just it's like a mindful a way of experiencing your body sensations from a neutral
Mm-hmm.
place.
Which is
It very
interesting
much
because,
dovetails with this. Yeah.
I mean, I think dancers in particular, or at least my experience was, um, experiencing pain, experiencing all the sensations, but being able to override all of them, like not actually valuing them. So it's not that I didn't feel pain. It's that I
Yeah.
didn't, that was less important to me than what I was doing. And so
Mhm.
it was like pausing at the bottom of the exhale and hearing a request to breathe. And then sort of like, in an entitled kind of way, like I'll decide when I'm gonna, like not really acknowledging what you're saying, which is you don't
Yeah.
really have a choice here. You just
Yeah.
have a choice around the response, and you don't even have a choice about the response. You're gonna respond,
Mm.
but the how is there. And I think, you know, I for me it was such a journey of having to learn
Mm.
to value subtlety, to value the littler, tinier sensations, and begin to develop a language and communication with them that had more care, maybe, or respect. But it's interesting because I think, and in what you're saying too, there's such an emphasis on in our world and working with people about increasing sensitivity, increasing and the ability to listen, the
Mm.
ability to pay attention, to
To be
understand there's a
embodied,
choice.
yeah, to live inside your own bodily experience.
But also they're the people where sensitivity is the limiting factor, right? Like that's almost that there's a relationship or story around
Oh yeah.
everything having such impact and priority that there's an inability to tolerate all of the sensation or the sensitivity.
Well, but then you're talking about people who perhaps have trauma in their background for whom that shows up as an absolute threat to their existence. And the way they survived their trauma was to uh, leave it behind or disassociate from it. Um, and so then you have parts of the brain that register a threat to your existence when that information starts
Coming
showing
in.
up.
Yeah.
And that's something to definitely acknowledge is a reality for certain people. I talk about this all the time when I'm teaching other yoga teachers,
Mm-hmm.
about how to hand as much agency over to people as they can tolerate, knowing that some people can tolerate very little of it. Um, and some people need a lot more of it, and they're all in the same space with you, following your cues. So that'll cause you to reevaluate your language, um, and also make you not want to tell people what they should be feeling.
Oh God, please
Yeah.
stop. Yeah. I don't like art that tells me what to feel, much less a teacher that tells me what to feel.
Yeah. Well, yeah, absolutely. Yeah. And it's true in all arts. Some people have a message and they hit you over the head with it. And
Snooze fest.
yeah, but some people leave you so out in the stratosphere with nothing to hang on to that that's annoying too.
Right. Give me
Yeah.
something to stand on.
Yeah. Is there an
Meet me
actual
where I'm at.
idea here, or is
Yeah.
your idea to avoid ideas and just leave us feeling completely out to sea?
Uh-huh.
Yeah. So those are, again, space and boundaries, stira and sukha. This is what we started with.
Yeah.
Yeah.
Well, Leslie, so tell me before we wrap up, your family's good, your kids are good.
Yeah. The kids, I have three boys, as I
Mm-hmm.
think you might remember. They were all home births, to go back to the birthing experience. The oldest is now, he's just turned 30, about to turn 34. Jai, the middle son, is about to turn 29. And the youngest, Sasha, who's living here in the city, just turned 24.
Do you like
So,
having adult children?
um, yes and no. I mean,
Yeah.
the thing that I miss is, just um having the kids around, it's around the holidays mostly that I miss them.
Oh,
'Cause I'm a
yeah.
real sucker for
Yeah.
putting up the tree and decorating it and
Same.
staying up and wrapping presents and, all of that. Um, so, and we bring them back together around Thanksgiving and still do some stuff. But I like that, they're mostly self-supporting at this point, you know.
That's pretty great.
Yeah, yeah. The two of them are fully launched. The youngest is, partially.
Mhm.
So that's nice.
Well, congratulations. That's not nothing,
And
you know.
yeah, you got a pretty full
I've
tassel
got a
on you.
brood. Yeah.
Yeah, yeah, the inherited and the birthed.
Yeah. The older two are it is fun having adult kids. They're in the brackish middle ground
Yeah.
of not fully being gone, not fully being here.
Mm.
So I'm
Yeah,
sort
but
of in,
it sounds like pursuing their interests in a really strong way, which is
yeah.
what you really hope for.
Mm-hmm.
Yeah.
Yeah. And the youngest, the 9-year-old actually has a show at Streb coming up. She's in circus arts and is doing straps, which
Wow.
part of me was like, wait, what are we doing here? What's
Well,
happening?
with you as a guide, I'm sure some of the gnarlier aspects of that can be avoided.
I hope
Hopefully.
so. We'll see.
Right. Are we talking about contortion level flexibility?
She's she's super strong. And
Hmm.
that's the part I think I feel the most
Well, good.
good about, healthy about, because I know strength will take her where she wants to go.
Hmm.
Um, she's not the most flexible kid. I mean, she can definitely pull her leg. That's one of the tricks, you know.
Yeah, but you can't sit in
Um,
your own head.
no, she's not doing that.
Okay.
And we've talked about hypermobility. So she
Yeah.
hears it from me.
Hmm.
My son is in doing a lot of jujitsu, which is
Oh,
also kind of cool and also like some joints. I get nervous about joints.
well,
What
yeah.
was your face you just had? Tell me.
Well, no, but if he's rolling with lower belts, that's where he's in danger.
Well, they're all beginner. They're all on the same
Okay,
level.
so he's like, yeah, it's just starting. Yeah, well, it's in the beginning that people, when you're rolling with people who don't exactly know what they're doing, if you're rolling with a higher belt, you won't get
You're
hurt.
safer. Yeah.
You're much safer, much safer. Yeah, yeah. But live and learn, and young people recover quickly. And that's the one martial art that I'm really curious about trying. Although at my age, with my arthritic knees, I'm a little worried about the bone on bone situation I've
I
got
don't like
going.
the torquey stuff. Like I tell him, I'm like, put me in a hold. Like, let's do it. Show me the thing. And so he'll like get me in a hold and he's like, try to get out. And so one of the things he does is like torques my joints. And I'm like,
Yeah,
no, 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 no.
yeah, you got to tap really quickly there. They've got to let go really quickly.
Right.
Yeah.
And I think it's good for him because this is a sensory kid. Oh my
Mm.
God. Needs pressure, touch, contact. Like I mean,
Oh, that's
he doesn't
custom.
believe me, but he's a dancer in
Oh
his
yeah.
heart. He's a full on expressive. I mean, the way he's in his body is so interesting. But
Yeah.
what he's learning right now, which is, I think, crucial for him in particular, is that kind of boundary work.
Interesting. Well, contact would be another thing for a kid like that,
Oh, yeah.
right?
And he learns with parkour. There's a really interesting conversations around risk, risk assessment,
Hmm.
feeling fear. How do you work with that? I mean, they're pretty deep. They do deep inquiries around
Hmm.
scaffolding something. When do you take that leap? How do you figure out if that's something you want to do? And he's not someone who's aiming for big thrill at
Hmm.
all. So
Yeah. Well, but your kids, not surprisingly, have a very physical, embodied existence and are
yeah,
pursuing them
I
in their own.
should show you. We have a whole steel grid in our apartment that we installed in 2020 because the park's closed and I freaked out. Well,
Oh,
there's nowhere to climb,
you
and
have
climbing was
a jungle gym of a.
basically it's set up so you can do when we hang silks and hammocks and ropes and you can put all kinds of things in there or you can just hang, there's a higher bar, you can hang, you can swing, but we've all gotten on there. And
Does anyone ever come into your apartment and get the wrong idea and think that like you're a
yeah. Oh,
dominatrix?
I think, yeah, totally. When I get a fresh direct delivery and the door opens and there's a bunch of ropes hanging from this grid, I'm always a little sheepish about thank you.
Little, just don't use leather on any of the parts.
I know. Well, the straps are pretty intense looking. Have you seen the just they're like thin black straps, that
Oh, okay.
hang.
Hey, I grew up around Pilates reformers and gyro towers and
Yeah.
things like that. So how different is it really?
Right.
Yeah.
Yeah.
This has been so awesome, Weena.
It's been so, so fun. It's been so good. And it feels really important for me to like acknowledge and reconnect with you in the way that um, you've influenced my work and perspective in a really deep way. And I don't know that I've ever
Mm.
told you that. I hope you know that. But
I when I was listening to you on Jay's podcast, I got that sense. And it's funny that you reached out because I was thinking of like, I just gotta talk to Weena.
yeah.
Catch up with Weena.
Yeah.
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 So
And I think I remember when your book came out, I was
mm,
so tickled you signed it, but you said something, you wrote something like I can't remember exactly, but it was something like something about I made you a good teacher to the effect that I was a little bit of a pain in the ass and just like constantly asking questions. But um yeah, and I think I realized too how, and I don't know if it's because I've been in New York 25 almost 26 years now, 20 or
mm,
more. Jesus, it might be 28. Um
more than a quarter of a century. Think of it that way.
so yes, that
There you go.
there's this circle happening in this last year in particular of kind of returning to what feels like some of the impulses or um, generative thrusts forward that first happened when I came here. I feel them sort of coming into
Oh,
my life in little sneaky ways again. And this is sort of one, and it makes me realize too, I need to come see your office. And
oh, we should get together and do an exchange, and
oh,
that
I
would,
would love it. Yeah, yeah, yeah.
or maybe I'll come to Jackson Heights,
Oh my
and
God. If you like good food, this is where it's at.
that's where we go for Indian food.
Yeah. There's
Yeah.
an incredible, we should totally do that. There's an incredible Burmese restaurant. I don't know if you
Oh, wow.
like that. There's really good food. I'm gonna,
Let's
well,
make sure
thank you.
that happens. Yeah, for sure. Yeah.
Thank you so, so much, Leslie.
It's been an absolute joy to see you again and to connect with everything that you're doing, and absolutely having people like you uh, come through my life as a teacher, I can absolutely say has made me better at what I do. So it's
Thank
all
you.
mutual. Yeah.
Well, I'm inspired too by just your, and I can still feel it, the same sort of vibrant curiosity and your big eyes and desire to sort of be in the world and with people and learning. There are different ways people move into elderhood. And I think I really gravitate towards that version, which is like, I'm still really curious. And it's not
Mm.
even that I'm calling you an elder, but I'm
Well,
not that. Yeah.
there's
But
no way I'm not an elder. I'm way past middle age. I'm probably not going to live to 122. So yeah.
well, there are people who are your age who I would not consider elders. Like they haven't sort of like owned that.
Yeah, they're just old. Yeah.
Yeah, exactly. And I think to me, there's something actually more vital and important and
Mm.
rich about claiming elderhood because I think it's a really important role to serve. And it doesn't mean knowing. I think that's part of what I mean. Like your style of it is not about like I've got the answers and I know everything. It's really like here's what I'm so excited about and here's what I'm going to keep learning about and here's what I want to keep investigating. And that's really precious. And
Well, thank you. That's really nice to hear. And yeah, the elder part really shows up mostly when it's reflected back to me, either by a mirror or by you or some, because when I'm just walking around living behind my eyes and I can't see the gray and the wrinkles and everything, I still feel like that, 20-year-old kid who had his first yoga class, you
Yeah.
know, and I'm often shocked when I pass by a mirror and go, oh, geez, you're an old fuck now, aren't you?
Same.
Yeah,
Yeah. That's the mystery of aging where you're like, wait, what? That's not
exactly.
what it's like inside here.
Yeah,
Yeah.
exactly.
Leslie and I went well over the 2 hour mark, and I had the feeling we could have gone for a couple more. Congratulations if you made it all the way through. You can find Leslie and all of his upcoming teachings, offerings, writings, and more at his site, yogaanatomy.org. Thanks for listening. Until next time.